the ability to look at large populations of patients is opening up new windows into the challenges and the risks around fluid management. I think as clinicians, we've always known that giving too much fluid is a problem, as well as not giving enough fluid. So that U-shaped curve of complications that we talk about, clinicians certainly in anesthesia and critical care, surgery, emergency room, we're very focused on under-resuscitation and not having enough fluid on board to support the circulating blood volume. We know that patients get into trouble there very, very quickly. So we've been very focused there at driving and improving outcomes by focusing on that area. Meanwhile, we've also known that giving too much fluid has always been a problem too. Having said that, though, oftentimes those complications don't show up for 48, 72 hours, and we're probably not tuned into those as much as we think as we should be. Certainly when you look at the data around this and some of the data that's becoming more apparent, the risks associated with volume overload is really quite impressive. And so this value proposition of getting data or getting fluid just right is really supported by the data, and that window, that narrow window of getting fluid just right is probably more narrow than we've appreciated, and staying within that brings more value than we've ever seen before. We looked at roughly 25,000 patients in a premier data set. And with that, what we were able to show was that fluid actually becomes an independent risk factor for complications. One of the earlier much of the earlier work has been observational in single center or a few multi-center studies. And the complication of fluid and patient severity has always been sort of intermingled, and the ability to tease that out has always been a bit of a challenge. And so it's unclear whether patients don't do well because they're sicker or because they got more fluid. But with these new studies and looking at the big data, we've been able to tease that out and build models where we can adjust for fluid, for patient complications associated with their disease severity and separate that from the fluid. And what we're seeing is that fluid actually becomes an independent risk factor for mortality. In sepsis, in this large data set, over about 5 liters of fluid, patients begin to experience increased risk with complications and increased risk in mortality over and above their disease severity. After about 6 liters of fluid, above that, mortality rises for about 2.3% for every liter of fluid you go over that on the first day. These large studies certainly are showing that this concept of being able to give fluid and then take it off later, frankly, that doesn't work so much. This has also been shown in the surgical literature. 36,000 patients undergoing abdominal surgery. Similar studies looking at this with the risk of fluid. Over about 5 liters a day of surgery. So this includes not only the operating room, but the recovery room, out on the floor. If you receive over 5 liters of fluid on your day of surgery, your mortality risk rises, and rises almost doubles after 6 liters. So all of this is really leading to some major, attention and focus on volume overload. There was a third study out of MGH and the Harvard system in Boston where they looked at 92,000 patients over a 7-year span. And again, they see these U-shaped curves that we all naturally assume with complications. But what was interesting is that fluid restriction leads to problems, fluid overload leads to problems. So it's really this value of getting it right is really important.